everyone. We're going to talk about hypothyroidism today, and I'm going to give you an opportunity to get onto our website and sign on for that thyroid workshop coming up in July. But today I want to talk about how hypothyroidism causes depression and anxiety. For those of you that don't know, my name is Dr. Shireen Banakdar. I'm a corrective care chiropractor right here in Frisco, Texas. And I'm also a detox and nutrition specialist. So if you struggle with chronic depression or other mood disorders, you may suffer from an undiagnosed hypothyroidism. A thyroid hormone deficiency can cause multiple brain-based symptoms. This is because the thyroid hormone plays a very important role in the function of many areas of the brain, including the neuron health, including brain immune systems called neuroglia, including the blood-brain barrier. And if you have a chronic mood disorder, you gotta consider asking your doctor to screen for hypothyroidism with a TSH test, and for autoimmune Hashimoto's with a TPO and a TGB antibody test in order to rule these conditions out. Now, hypothyroidism and depression. Let's talk about how thyroid hormone affects our neurotransmitters. Thyroid hormone impacts the major neurotransmitter receptors in the brain. Neurotransmitter receptors, so neurotransmitters are chemicals that are produced in our brain, and in order for them to get into a brain cell, we have these gates on our cells called receptors. So thyroid hormone impacts these gates in the brain, the gates for serotonin, which makes us feel good, the gates for dopamine, which motivates us, the gate for GABA that relaxes us, and the gate for acetylcholine that is involved in our posture and in our balance. So these neurotransmitters can help to regulate your mood, motivation, and executive function. The majority of research during the last 30 years has largely focused on this neurotransmitter model of depression, which emphasizes that there is serotonin and dopamine imbalances, and it gives you antidepressant medication to correct these imbalances. However, most patients experience only very limited success managing these depression with these drugs. Let's talk about brain inflammation. An explosion of research has actually found a connection between depression and inflammation called the inflammatory model of depression. In these patients, brain inflammation shows that there is a slowdown of nerve conduction and synaptic speed. So synapses are the way that neurons or brain cells actually communicate with each other. This decreased speed causes depression by slowing down the activity in that relative region of the brain. Because these cases are as a result of inflammation, traditional antidepressants are ineffective. So you go back to your doctor, and what do? They give you a second depression pill, they give you a third one, but it doesn't work because it has to do with the speed that these brain cells are actually communicating with each other. Inflammation-related depression can be caused by a traumatic brain injury, like a stroke or a systemic inflammation throughout the whole body. So if you have an autoimmune gut disease, that would be one of the reasons why you would have depression. Unmanaged Hashimoto's is, of course, another possibility that causes a systemic inflammation. The fluctuations typical with the condition also mean that thyroid levels wax on and wane, and there's periods of low levels that can result in significant depression. This could explain why your depression persists even after you begin treating your hypothyroidism. Then there is the blood sugar fluctuation. Whenever a patient mentions mood instability, my first instinct is to check their blood sugar. This is because blood sugar high and lows are very common causes of mood fluctuation. Anyone who's been hangry can attest to that. Now, Hashimoto's patients often do have unstable blood sugar levels, which makes them more prone to things like insulin resistance and both high and low blood sugars. Brain autoimmunity. When there is an immune attack on the thyroid gland, it's targeting the TPO enzyme and the TGB proteins. Antibodies to the TPO and TGB are used to screen for Hashimoto's disease. Unfortunately, sometimes these TPO and TGB antibodies bind to cerebellum tissues in the brain. They can cause some Hashimoto's patients to develop brain autoimmunity, and this inflames and degenerates the brain and can cause depression. Blood-brain barrier issues. So systematic inflammation, that is an unmanaged Hashimoto's disease associated with gut stuff like intestinal permeability, otherwise known as a leaky gut, can cause blood-brain barrier issues. So leaky gut patterns have been shown to make the blood-brain overly permeable, which makes the brain much more prone to inflammation. There was a study published in 2020, in this in the International Journal of Molecular Science that showed a connection between an inflammatory bowel disease, or what we call a leaky gut kind of a disease, to a leaky brain barrier in patients with autoimmune disease. Now, gluten. 2/3 of people with gluten sensitivity experience neurological symptoms instead of gut symptoms. This is because the tissue most affected by gluten sensitivity is the nerve tissue. Majority of Hashimoto's patients are gluten sensitive to or have celiac disease, which means that gluten can play a role in their depression and anxiety. Gluten cross-reacts with dairy, meaning that the immune system recognizes dairy as gluten, and many patients find their mood disorders significantly improves by just eliminating these two foods from their diet. If you think your depression might be related to a gluten intolerance, you can find out by getting that checked. And of course, hypothyroidism and anxiety. Anxiety is increasingly common these days, neurologically speaking. Anxiety is caused by a heightened activity in the amygdala and the limbic regions of the brain. The amygdala is responsible for regulating fear and aggression, and the limbic regions play a role in processing the whole spectrum of human emotions. You can often calm yourself down during an anxious moment by taking the time to reason through the issue. This is because activating the frontal lobe through the problem solving actually reduces that amygdala activation. But brain fatigue, inflammation, unhealthy neurotransmitter activity, and a slow nerve conduction all compromise the brain's ability to prevent overactivation of amygdala and limbic region. So the result is this massive anxiety. The factors listed above for depression, they also apply to anxiety. So the ones that I just told you about. Is hypothyroidism, so I guess the big question is hypothyroidism or Hashimoto's behind your mood disorders? How would you know? You can ask your doctor for a few tests if you think that hypothyroidism is causing your depression, anxiety, or other mood issues. A thyroid stimulating screen for hypothyroidism is great and it's helpful. However, keep in mind that the TSH levels really fluctuate frequently, and you may receive a false negative depending on when you did the test. If symptoms strongly suggest hypothyroidism, consider retesting that. It's also important to screen for TPO and TGD antibodies. These are the most common causes of hypothyroidism in autoimmune Hashimoto's. So these levels can fluctuate, especially in early stages. There is no single remedy for depression and anxiety. Unfortunately, there is no simple solution. Rarely will a single medication or supplement unwind these various mechanisms that underlie these conditions. Instead, you must go through the process of untangling the web, which is exactly what we do at our office. In our thyroid workshop coming up on July, let me tell you exactly when, July 12th, which is a Tuesday night, 6:15 to 8 p.m., what we're going to do is we're going to go over 4 things that have to do with a thyroid puzzle. And we are going to help you to discover which one is not working best for you. We're going to talk about how to test it and how you could help yourself naturally. So if you're interested, make sure that you hop on either to our website at www.harmonywellness-frisco.com, go to our events page, and you can click on the thyroid workshop coming up and register for that event. Or you can give us a call at 945-888-2988. Again, it's 945-888-2988. God bless. Remember who you are.